My name is Jane Padmore and I'm a consultant nurse in child and adolescent mental health. My background is in mental health nursing and I've worked in mental health since the early 90s and in child and adolescent mental health for the last 15 years. I have worked across generic child and adolescent mental health services in schools and in youth offending services. I developed my interest in ADHD through my work in the youth justice system in youth offending services, where I saw a lot of young people who previously hadn't engaged in child and adolescent mental health services but were having difficulties around attention and hyperactivity and getting into trouble a lot. My role in UKAP is to oversee the social media, so I oversee the Twitter, LinkedIn and Facebook sites, as well as bring a forensic adolescent mental health perspective to discussions. My experience in working and research in ADHD was initially in clinical practice and is currently in clinical practice developing an ADHD service in West London, and I currently work in the National Forensic Adolescent Mental Health Service where I see young people with ADHD. Research-wise, I have just completed a piece of research looking at the mental health needs of young people involved in street gangs and looked at the prevalence rates of ADHD in that population. I currently work as a consultant nurse in child and adolescent mental health, mainly working with young people who are involved in serious and violent offending, and I undertake reports for court as well as treatment and assessment.